my name is Claire Spencer. My student ID number is E3051101, and these are my AVMA task videos for lab animal clinical management.
I'm going to talk to you a little bit now about basic rat husbandry. As far as housing goes, they need a solid bottom cage with wire sides and a wire roof. They need access to clean, fresh water all the time, and they can be maintained on a seed-based diet. They can have fruits and veggies every now and then as a treat, but you want to keep those in moderation because they're not super nutritional for them. You want to make sure that they have a lot of good enrichment things in their cage. They really like wheels and they like tubes and things they can hide in and under and go around and burrow in, and just to keep them happy. You can identify them by their coat color or cage cards if you're in a clinic setting, or if you have a big colony of them, you can tattoo them, you can use microchips, and you can also use ear tags. As far as restraint goes, they're pretty simple. You can scruff them like you do a cat, which would allow you to flip them over, and they become pretty docile. You can also grasp them by the base of their tail, making sure you're very close to their body. If you go any further out, you risk giving them a degloving injury, which can be very painful, and you don't want to do that. To determine the sex of a rat, you'll go ahead and scruff them, flip them on their belly. Males will have a much more swollen area down here. This is a little girl, and you can see her opening up her vulva. All right, I'm going to show you how to give I'm going to show you a couple different ways to give medications to rats. You can do it subcutaneously, where you will just tent up their skin, get your injection, insert the needle, pull back, make sure you don't have anything yucky in there like blood, and then insert the medication. And you can also do oral dosing of rats. You'll go ahead and scruff them, get them pretty calm, turn them on their back, get your medication, insert it into their mouth, and dispense the medication. All right, I'm gonna go ahead and show you how to collect a blood sample from a rat now. You're gonna get an alcohol-soaked cotton swab to clean and prep the area. It also helps you visualize the tail vein. We're gonna go ahead and get our needle, make sure it doesn't have a cap on it. We'll go ahead and insert the needle. And pull back on the plunger until you get your blood sample, and that's how you do that. All right, so I am going to talk to you guys a little bit now about basic husbandry needs for mice. As far as a cage goes, they need a solid bottomed cage with wire sides and a wire lid. They need soft absorbent bedding material, making sure it's dust free and non-toxic for them. As far as food goes, they eat basically a seed-based diet. You can get it in pellet form as well, and small amounts of fruits and vegetables as a treat every now and then they will appreciate. You want to always make sure that there is water, fresh, available for them. They're pretty good about self-regulating, but you do want to watch them with their food because they do have a tendency to overeat and get a little bit plump. As far as handling goes, you want to make sure you're always wearing latex gloves just to prevent any disease spreading, nothing yucky like that. You can pick them up by scruffing them, and like that, or you could also grab them by the base of their tail, right by their body. You want to make sure you don't get the middle or the end because you can actually deglove their tail, which is very painful. They won't appreciate that very much. And to determine sex for a mouse, what you'll do is go ahead and scruff them gently and flip them over. And it's pretty obvious between male and female. Males have larger external genitalia. Their testicles are pretty obvious. Females will have a smaller slit down by their anus. That would be their vulva. All right, and as far as reproduction goes, female mice are spontaneous ovulators. They are continuously polyestrous with a 4 to 5 day estrus period once they are impregnated. The gestational period of mice is about 19 to 21 days, and the average litter size is about 10 to 12 pups. Now we're going to give this little guy a couple of medications. I'm going to show you how to do a subcutaneous injection under the skin. We're going to do an intraperitoneal, and we're also going to do an oral dosing. So for the sub-Q injection, we're going to grab a little scruff on the back of his neck, make a little tent, get our injection, and insert the needle, drawing back on the syringe, make sure we don't have any blood, and inject. For the intraperitoneal injection, we're going to scruff him, making sure the tail is between your fingers just for a little bit of extra stability. We are going to give the injection in the lower left quadrant of the abdomen. This is the preferred place for these injections because there's less chance of getting any internal organs or hitting the urinary bladder or anything like that. So we're going to go ahead and take our needle. We're going to inject, pulling back on our plunger, make sure we don't get anything we don't want, and inject the medication. And for the oral dosing, same thing, dorsal recumbency, scruffed by the neck, tail between the legs. Make sure you have your medication ready to go. Get in his little mouth there and inject your medication. And that's it. All right, I'm gonna talk to you now a little bit about rabbit husbandry. This is Matilda. She's gonna be my little assistant for today. As far as their housing goes, they need to be in flat-bottomed and wire-sided cages with wire or mesh roofs. They need a hanging food hopper and water bottle so they have access to fresh water all day. As far as feeding goes, you don't want to let them free feed because they have a tendency to overeat and can become obese. They eat a high fiber diet. They have commercially available over-the-counter rabbit diets that would be just fine. They actually can be taught to use a litter box as well with shredded paper bedding, which is pretty cool. You just want to be careful because clay cat litter or wood shavings are not advisable. Rabbits tend to eat them, and we don't want to get them sick. As far as handling goes, you want to make sure whenever you pick them up, you want to support their back end. They have a tendency to kick out and they can actually become paralyzed because of it. For identification purposes, there's a couple of different options. They can be tattooed in their ears. They can get microchips with identification numbers. As far as a clinic setting goes, though, we just use cage cards or we identify them by their coat and their markings. You also want to be sure you have a lot of enrichment items for them available, things to chew on and nibble on to keep their teeth ground down, and just other things to play with and keep them happy and healthy. As far as restraint goes for rabbits, you want to make sure that their back end is always supported, like I said earlier. They also like to be close to your body, and they really like their heads and their eyes covered. It's important to use soft, quiet voices, make sure there's no loud or startling noises when you are working with them, because it tends to freak them out, and we want to keep them as calm as possible. All right, and now as for determining the sex of a rabbit, it's fairly simple. You just have to look at their posterior end. Male rabbits will be much more swollen because of the testicles. Female rabbits less so, but they do have a little vulva. And if you gently press the sides of it, you'll see the opening of the vagina. All right, and as far as reproduction goes, they are induced ovulators. Their gestational period is between 25 to 35 days, and their litter size is usually between 4 and 12 kits. All right, now I'm going to show you how to give a subcutaneous injection for a rabbit. It's fairly simple. You'll just grab some skin and tent it up. We're going to take our needle and insert it. And we're going to gently pull back on the plunger, make sure we didn't get any blood or anything else we don't want, and then inject your medication, and that's it. All right, now I'm going to show you how to collect a blood sample from a rabbit. You're going to take your alcohol and a piece of cotton. You're going to make sure it's the area that you're going to collect blood from is clean, and it also helps to visualize the vein that you're going for. So once it's all nice and clean, you can take your needle and just insert it into the vein, pull back on your plunger, until you collect your sample, and that's it.
You make sure. All right, you're good to go.
All right, I'm going to talk to you a little bit now about some bird care. First off, we're going to learn how to do some restraint techniques. The easiest one I have found, especially for smaller birds, is using a towel. It helps calm them down, and it gives them something to nibble on and chew on while they are being restrained. There's also restraint boards for bigger birds, which are especially helpful if you're doing x-rays. And you can also, on parrots, do the Elizabethan hold, but on little birds like this guy, that doesn't really work. So now I'm going to show you how to do a nail trim on a bird. If the bird's pretty docile, you can probably do it alone, but it's always best to have someone help you out, just in case. All right, so when you're doing a nail trim, you always want to make sure you have Quick Stop handy and available, ready to go in case you accidentally click them, because any loss of blood for birds can be a pretty big deal. So then what you're going to do is take your nail trimmers. Cat trimmers work really well, as do suture scissors, which is what I'm using right now. And then you get the little bird nails, and you take off just the littlest bit, making sure you're trimming just the nail and not another toe. And I did just quick him a little bit, so I'm going to go ahead and apply the Quick Stop before anything happens. All right, and then you move on to the next little foot. And one thing I want to mention while I'm doing this, it's really important when you're restraining birds to make sure that you are not pressing down on their chest at all, because that can restrict their breathing, and that's not a good thing. All right, and there you go. All right, and now I also want to mention really quickly about obtaining objective data on birds when they come into the clinic. You want to make sure to look at all of their bits, their beak, make sure it's not overgrown, make sure their eyes are clear and free of discharge. You want to make sure their feathers are all nice and pretty, there's no plucking or self-mutilation going on. You also want to make sure you're talking to the owner, make sure everything okay is going on at home, that there's nothing stressful in the house. You also want to make sure to talk to the owner about how much they want the bird to fly, if you're going to do a wing trim on them, if you want them to fly a lot, if you want them to fly a little bit or not at all. That's really the owner's preference, so you want to make sure you're talking to the owner and communicating with them to give the bird the best quality of care that you can.